So a priority health issue in Jackson County are sexually transmitted infections. We're going to look at the increase in cases that Jackson County has and also the at-risk populations for sexually transmitted infections. In 2016, looking at chlamydia, there was an 8.48% increase in the number of cases in Jackson County. Females did represent the majority of those cases with 69%. And looking at the ages for males and females, 81% of those cases were either in their teens or 20s. Looking at gonorrhea, there was an 84% increase in 2016. Males did surpass the number of female cases, so males represented 52% of the cases in total. And then looking at the ages overall for both male and females, 79% of all the cases were in their 20s and 30s. Syphilis had a 38% increase, and males do represent the vast majority of these cases with 75%. The ages of the males tend to be a little bit older, with between 30 and 60 years of age. In sexual orientation, majority of the cases are men who have sex with men, or MSM. Looking at national data, the primary and secondary syphilis in the United States, 52% of the cases were MSM, and 6% of those were men who have sex with women and men. There's also been an increase in female cases, both locally and at the national level. Even though this number of the total cases is smaller, what is concerning is that when we have more female cases of syphilis, you also see an increase in congenital syphilis. And also the female cases tend to be younger than the male cases, putting them more in the reproductive age range. And so in 2015, there were actually 2 congenital syphilis cases in Jackson County out of the 6 total for the state of Oregon. And it wasn't until 2014 that congenital syphilis was pretty rare in the state of Oregon. So looking at risk factors, risk factors that lead to the spread of sexually transmitted infections are having unprotected vaginal, oral, and/or anal sexual intercourse. By not wearing a condom correctly and a condom each time sexual intercourse takes place, those individuals are putting themselves at risk for contracting sexually transmitted infections, but also transmitting sexually transmitted infections to others. The number of sexual partners also plays a role, so the more partners that a person has is another identified risk factor, as I mentioned. So the increased number of partners that one has, then they are putting themselves at risk for contracting sexually transmitted infections. Men who have sex with men is also another risk factor. Some of these reasons have contributed to men who have sex with men not wearing condoms during anal and oral sexual intercourse, and some of them have, or many of them have, a higher number of sexual partners, again putting them at risk of contracting sexually transmitted infections. Illicit drug use is another risk factor. Some of the reasons for this is that often sex is traded for drugs, and there is an increase in the number of sex partners that tend to be anonymous, and again, condoms are not worn during sexual intercourse. Recently, hookup apps such as Grindr, Adam for Adam, and have really been looked at and identified as a risk factor for the increase of sexually transmitted infections among the MSM population. Studies have looked at the increase of syphilis around MSM and have found that those who use these apps tend to have more sexual partners than those that don't. So again, just engaging in more risky behavior, and again, not wearing condoms during sexual intercourse, and an increase in the number of anonymous hookups. And overall, this has increased the risk of contracting syphilis, chlamydia, and gonorrhea, and also HIV. Lack of public health funding is also an issue. So continually, public health systems are losing funding to have sexually transmitted infection clinics, disease testing clinics that are LGBTQ friendly, that are youth friendly, and then also losing funding for health departments to investigate sexually transmitted infection cases and outbreaks, and also educate the community in these at-risk populations about STIs. Per Jackson Bowers, the health department director in Jackson County, they no longer receive funding to implement a disease intervention specialist role there. This role, main responsibilities were really looking to investigate all reportable STI cases and provide education. And according to Jackson Bowers, there's too many cases of STIs in Jackson County to not have dedicated staff to investigate the cases and provide education. And again, yearly testing is crucial, especially around high-risk populations. But if they don't have somewhere to go to get tested, that they feel comfortable, that is welcoming, that is affordable, those who need to get tested decrease, but also having an educated medical community about when to test these high-risk populations is also a barrier for folks getting tested regularly. Looking at resources for Jackson County, currently Jackson County does have STI clinics. These locations are with Jackson County Public Health, Planned Parenthood, La Clinica, and Rogue Community Health. La Clinica and Rogue Community Health are federally qualified health centers. Another resource that is available is that Jackson County Public Health, between their health promotion programs and their communicable disease work, they've been able to recently apply to a 5-year grant that will allow the county health department to concentrate on improving their STI rates in the county. They're also working on applying to another 18-month grant between Jackson County Public Health and in conjunction with Klamath Falls County to work on the increase of STIs as a regional approach. Also, Jackson County receives grant funds from Oregon Health Authority to teach comprehensive sexual health education that is medically accurate. The curriculums that are taught are FLASH, Rights, Respect, Responsibility, and Cuidate. These curriculums are taught in middle and high schools throughout the county. Also, the educational standards in Oregon are some of the most advanced in the country. So again, these resources provided will assist schools in providing comprehensive and medically accurate sexual health educations to the youth. And last, Jackson County has a regional health equity coalition called Southern Oregon Health Equity Coalition. Jackson County Public Health is a representative on this coalition that has the mission to advance policy, systems, and environmental changes that promote equity and address social determinants of health.